tracks. So on track A, we have basic and translational research. On track B, clinical research. Track C, epidemiology and prevention research. Track D, social and political research, law, policy, and human rights. And track E, implementation research, economic systems, and synergies with other health and development sectors. For more information about the tracks, scope, and objectives, I would ask you to check the conference website. You can see the links at the bottom of the slides, and also to see the list of track categories under which you will have to submit your abstract. Abstracts can only be submitted through the conference profile on the website. So you can see here the little link that guides you to it. If you already have a conference profile from other conferences, you can use that one, or you will have to create a new one. On the overview page, you need to click on abstract submission, and then you have the little link on the right-hand side to the abstract submission system. Again, submissions by fax, post, or email will not be considered. The conference offers two available options for abstract submission. So we have one option which is most suited for research conducted in all disciplines, and option two, which is most suited for lessons learned through program, project, or policy implementation or management. And the decision is that there is a concern that the traditional structure of the background, the methods, the results, and the conclusions sometimes is difficult for certain groups that actually do more project implementation, project management, without having a formal research question and the subsequent methods. So the difference between the two forms, it's not so much who does it. Is it a community group, or is it a faculty group? But more on how it is done. And you can see that, for example, community-based research can easily fall under option one if scientific methods are applied, while someone that does more evaluation or monitoring would probably choose option two to submit their abstract. So on this slide, you can see some examples of abstracts that could be submitted under option one and option two. And given that this webinar is more referring to option two, let's just check that list. So we would have key findings from evaluation studies, lessons learned while implementing HIV programs, for example, mobilization of most vulnerable communities to end stigma, discrimination, violence, and advocacy for universal access to treatment. For example, adapting HIV and AIDS education projects and the impact of local context, or also the development of user-friendly HIV prevention services. This is just examples, so you can see what would fit more each one of the two options. Now, one thing that is important while you're submitting your abstract is that it's not possible to change the submission form in the middle of the application process, which means that if at the beginning you choose to select your abstract under option two, you can't change this. If you would like to change, you need to withdraw your abstract and to submit a new one, and now use the other option form. After you selected your option, you will do the track and category selection. And the track category is a general heading under which the abstract will be reviewed and later published on the conference printed matters if it is accepted. So it describes the subject of the abstract. So the first step would be to select your track. For example, let's take track B, clinical research, as an example. And after it, you see the little plus and minus signals. You would see a list of headings under the track B, and your second step would be to choose that one. And we have here linkage and retention in care. And after that, you would see the actual list of categories, the underlined ones, under which you will submit your abstract. And this will be your third step. In this case, retention in care. So for everyone that is concerned about how to choose the track, how to choose the category, all completed abstracts will be reviewed. So if you think that the track of category selected is not the most suited for your abstract, it will be reviewed anyway. The process might be a bit delayed because we might need to send it to a different reviewer, but all abstracts will be reassigned and reviewed. In addition, let me also just mention the HIV Cure Symposium. Abstracts that are pertinent to HIV cure research can be considered for the Towards an HIV Cure Symposium. And the same submission system is used for both events, for the symposium and for the AIDS 2014 conference. So you can see here before the categories that there is the logo, the Cure logo, and this means that abstracts, if you select this category, you may, if you wish, to submit your abstract to both events. You will need to explain briefly how the abstract is related to the cure research. There's a box for that, but you can choose to submit it to both events. For more information regarding the Cure Symposium, please check the link at the bottom of the slide. Your next step will be to write your abstract title and the abstract text. The maximum words at the title of the abstract is 30 words, and in the text you can use up to 350 words. You may, if you wish, include tables at a maximum of 3, given that each row counts as 10 words, and you can also include images, again a maximum of 3, and each image will count as 50 words. And you can check the progress of your word count at below, because you can see the maximum, and as you're entering your text, the system will also count the remaining words that you have available. And my colleague Miriam, in her presentation, will lead you a bit more on what should be inside each one of these parts. Regarding the submission system navigation, you may at any time save the abstract as a draft and log out of the system, come back again, completing it again, and submitting the abstract at a later date. You may modify all abstracts until the submission deadline, and you should remember to submit your abstract again after making your changes. So just a reminder, the submission deadline is the 6th of February 2014. Until then, you can do changes to your abstract. You can submit it how many times you wish, but only submitted abstracts will be considered. Let us also give you some common reasons for abstract rejection, and this is important when you're writing your abstract. So an abstract which is poorly written, which doesn't have enough new information, where there is a clear objective and a hypothesis missing, when the linkage between the different parts of the abstract is not very comprehensive. And this would include the background, the description, the lessons learned, and the conclusions, next steps. Sometimes there is duplicate or overlap with another abstract, for example, coming from the same institution. If the study, the project, the program, the policy is too preliminary or insufficient to draw conclusions, and if there's also a lack of originality. In addition to these common reasons for abstract rejection, there's also some that are more specific to one of the two options. So in option 2 would be if the description is inadequate or if it's insufficient to support the conclusions, and if the lessons learned are inadequate or are missing. Just now, guiding to some important submission policies. One of them is the resubmission policy, and it says that an abstract which has been previously published or presented at a national, regional, or international meeting can only be submitted provided that there are new methods, new findings, updated information, or other valid reasons for submitting that can be provided by the author. So when you are submitting, if you have already published or presented partial data, you are asked to give reasons why this abstract should be considered for AIDS 2014. And this decision will be considered by the scientific program committee when making final decisions. Another important policy is plagiarism, and the conference organizers regard plagiarism as a serious professional misconduct. And all abstracts are screened for plagiarism, and if it is identified, the abstract and also all other abstracts submitted by the same author are rejected. And just to let you know, in addition, the submitting author's profile and a scholarship application, in case there is one, will also be cancelled. And lastly, embargo policy. In the case of AIDS 2014, as with most scientific and medical conferences, abstracts are under a strict embargo policy. For example, information about the oral abstracts cannot be published or presented before the start of the presentation at the conference. And information about the abstracts being presented at the poster exhibition or at poster discussion sessions cannot be published before the Friday before the conference, when we start distributing delegates back. Breaks to the embargo will be studied on a case-by-case basis, and as an ultimate consequence, it could lead to the abstract being withdrawn from the conference. So authors may publish the fact that their abstract has been selected for inclusion in the conference program, but they cannot publish the results of the study before the lifting of the embargo. And for more information about all the submission policies, you should check the conference website, where you can have access to the submission guidelines. And you have the link at the bottom of the slide. And last, let me just talk a bit about the late breaker abstracts. So late breaker abstracts present data that is gathered after the regular abstract submission deadline, which is the 6th of February. And it opens from the 24th of April to the 15th of May of 2014. Data that is analyzed after the regular submission deadline should not be submitted as a late breaker research if the data does not meet an extremely high scientific threshold. You have to remember that only a small number of late breaker abstracts will be accepted. Of course, the percentage will depend on the number of submissions, but the selection will be very significantly more rigorous than for regular abstracts. During the submission, the author will also have to declare why their abstract is actually a late breaker, and this will also be taken into account when making selection. The same submission system is used, the same submission rules apply for the late breakers as for the regular ones. And again, just let me point out the submission guidelines where you can access more information about this. I finished my part here, and it's 15 minutes is not a lot, but just a reminder that all this information is available at the conference website under the Abstracts tab, and we will also have very soon a PowerPoint guiding you on how to submit an abstract, how to deal with the submission system with a step-by-step. So we're looking forward to receiving everyone's abstracts. Thank you.
Welcome to the webinar. I am going to present on the Abstract Mentor Program. My name is Miriam Körner. I'm the Managing Editor of the Journal of the International AIDS Society, and I'm working together with Kim Minaj from the Program Department on this Abstract Mentor Program. So the Abstract Mentor Program, what is it? It is a service to provide feedback on your draft abstract from experienced abstract submitters. And it is intended for anyone who wants help to improve their abstract before submitting it to the conference. It is important to note that this program is not a language checking service, so your abstract must still have a good level of English. You can receive feedback from the 18th of November onwards. That's when the program opens. That's next Monday. And you can submit your abstract, and we will provide you with feedback within 10 days by email. The program closes on the 22nd of January, and we aim to provide you with the final feedback on the 2nd of February. So you still have a few days to revise your abstract and submit to the conference. The deadline, which is the 6th of February. How do I submit my abstract for mentoring? There's a few steps you have to go through. First of all, you have to have a conference profile on the website AIDS2014.org. This is the same profile you're going to use to also submit your abstract to the conference itself. As you can see here on the red slash, my conference profile, and you create a new profile. Step 2. You then get a list of services that you can access from your conference profile. And the first one on the list is the Abstract Mentor Program. First of all, when you want to use the Abstract Mentor Program, you have to use the e-course. This is an online learning course to show you how to write an abstract. This course is hosted by the Health E Foundation. So you go to the Health E Foundation website, you complete the course, and you get an access code, which you need to submit your abstract to the program. This is the Health E Foundation e-course. This is the first page you come to, and then you click on Start the Module Conference Abstract. Then you can see that you will come to a menu, and the menu is structured to help you through the abstract writing process. You need to complete each of these chapters, and at the end you also have to complete the post-survey. At the end of the post-survey, you will get the access code. Once you have the code, you can go to the Abstract Mentor Program Draft Abstract form. Here, there are several steps to go through. First of all, you have to enter your code. The second step is you have to choose option 1 or option 2 abstract. So today we're talking about option 2 abstract. So here then you would choose option 2. If you are not sure, you can choose either. It doesn't make a difference. We will still provide you with feedback, and this is actually something you can also ask the mentor to help you with. You also have to choose a track and a category that you think you're going to submit your abstract to. Again, here you can choose anything you want if you're unsure, and you can ask the mentor for more help. This is the part of the Abstract Mentor Program Draft Abstract form where you enter your abstract. So you enter your abstract title, and again it has the same word limit as you have for the conference. So for the title it's 30 words, and for the main abstract it is 350 words. And you can see that the program helps you to monitor your word count at the top right. Then you come to the part which is optional, so you can, as with the normal submission to the conference, you can select files to upload with your abstract, such as tables and figures. Note that these tables or figures have to be in Word, Excel, or JPEG format only. Otherwise, we cannot process them. Then you have the box where you can ask your mentor a direct question. And this is actually a mandatory box, so you have to ask at least one question to the mentor. If you're not unsure, there's a few examples given in the text above the box. Step 4, abstract feedback. So you can expect feedback on the structure of your abstract, the scientific content, the writing style, so if information is in the right order and is in the right sections, and if you have provided sufficient detail or if there is superfluous details. Mentors can also provide you feedback on the option, category, and track choices you've made. Again, do not expect feedback on the English language. This is not a language service, and the mentors will also not be able to comment on your chances of being accepted. The mentoring process is completely independent of the abstract review and selection process of the conference. Step 5 is, once you have received your feedback and you have revised your abstract, you can either choose to resubmit the same abstract that you have revised for a second round of mentoring, and we will try and use the same mentor again, so the mentor can help you check if you have implemented the feedback correctly. Or if you have a second abstract that you would like to submit to the conference and would like additional feedback on, you can submit a second completely different abstract to the program as well. And that takes me to the end of the Abstract Mentor Program presentation, and I will now go on to how to write an abstract. Just a note about JICE, the journal. We are an online-only peer-reviewed scientific journal and free to access. Our main mission is to strengthen research capacity in resource-limited settings and to support less experienced authors. We therefore organize skills-building workshops, training in scientific writing, and we also mentor authors. Before we look at how to write an abstract, let's revisit the definition of what is an abstract. The conference abstract is a summary of your work that you would like to present and includes all the important details and findings from your program. It is important to remember that the abstract-driven sessions at the conference are more scientific in nature. Delegates look to these for evidence-based best practices and lessons learned. The difficulty in writing a good abstract is its length and trying to squeeze in all the information in a tight word limit. While developing your abstract, you really want to constantly think, can I say this more concisely in a clearer way? My colleague Philippa presented in detail the guidelines for AIDS 2014 abstracts, and I recommend to carefully go through them again on the website as well before submitting. The requirements are that you need to structure your abstract into 4 sections with the headings background, description, lessons learned, and conclusions or next steps. Then there is, of course, the title and the optional figures and tables you can include. I will talk of each section in turn and give an example to show what to look out for when drafting your abstract. In the title, you need to summarize your program in 30 words or less. Your title, therefore, needs to be short, specific, and also representative and informative at the same time. Think of the question, what is the topic? Who is the population? Where was the program implemented? And how was the work done? It is not necessary to give away your conclusions in the title. These declaratory titles can sometimes be misleading, as you will struggle to fit in a title of 30 words all your findings. You're better off giving the abstract reviewers and delegates an accurate picture of the scope of your work in the title. Think of your title as your mini advertisement. Delegates will read the title in the conference program and make a decision what to go and see, as there are many competing sessions. If your title is too broad and people cannot figure out if they will be interested in what the presentation will be about, they will go somewhere else. Let's look at an example. Learn to lead. Training opinion leaders increases HIV knowledge. Thinking about our questions now, what is the topic? A training to increase HIV knowledge. Who's the target population here? That's opinion leaders. Okay, that is a good start, but there is no information about the where and how. So although it gives us some indication of what this abstract will cover, the title could be more specific. Catchy phrases such as this one here, learn to lead, may sound quite clever, but do not really add value to the title. An improved version of this title could read something like Evaluation of an HIV Knowledge Training Program aimed at African American opinion leaders piloted in the District of Columbia, USA. So in this title, we cover the what, the who with African opinion leaders, the where in USA, and the how. It is an evaluation of the training. So that is a lot of information in 20 words. Some general comments now about the main abstract text before I go on. Next, again, as Philippa mentioned at the beginning of the webinar, this part cannot be longer than 350 words. We want to aim for a balance amongst the 4 sections. That does not mean they have to be exactly the same length. However, you may want to ensure that not one section takes up all the space. So, for example, if the lessons learned section is too short visually already, your abstract doesn't look like it contributes significant new knowledge to the field. That's not a really good first impression. If you use up all your word count in the background section, you will not be able to cover much of your program or study in the rest of the abstract. So just keep that in mind. In addition, as it said in the definition of the abstract I showed at the beginning, it has to be a standalone piece of writing, i.e. it has to contain all the important information for a reader to understand the work you did. It's always a good idea to give your abstract to a colleague or friend who doesn't know much about your study and get some feedback. Having to write in English can be a challenge for non-native speakers. Unfortunately, there's actually no good way around this. So use spell and grammar checks as best as possible. Find an English-speaking colleague to proofread, or even use a professional service. It would be unfortunate if peer reviewers cannot accurately assess the merit of your abstract because they have difficulty understanding your writing. A note about abbreviations. Don't use them in the title. In the main text, you can use abbreviations if they are well known already, and if the term is used more than 3 times in the actual abstract. Always spell out abbreviations the first time you use them. For AIDS 2014, exceptions are HIV and AIDS. They can always be used and without spelling them out first. Moving on to the background section. This is the introduction to your work. Here, 3 main messages need to be included. By answering the questions, what is the topic of the abstract? Why was the program done, or the project or policy? What was the aim? This will give your readers information about the general topic, the motivation behind the program, and the aim, what you try to achieve with your work. You want to adapt the level of your introduction to your audience. So you're going to a specialized HIV conference where everyone will be familiar with your topic, then you can focus in much more specifically on your background section. However, if you go to a more general conference, or even AIDS 2014, which is quite a multidisciplinary conference, you may want to give your readers a bit more background to your topic because they might not be exactly experts in your field. Here an example of a background section. So we're looking at 3 elements that should be included. The topic here is African Americans affected by the HIV epidemic. The motivation for the study seems to be the late presentation of HIV-infected individuals. But it's not actually quite clear in this background what the specific problem is that the program tried to address. Lastly, the specific aim of the study is presented, which should be in the last sentence of the background. But again, it could be a little bit clearer. We give the information that the training program was implemented, but exactly what the study aimed to accomplish is a bit unclear. Again, I think we can tighten this up and improve the background. So we can leave out maybe the first sentence, which is a very general statement, and again, the audience at AIDS 2014 should be familiar with these figures. So let's try and build in more specificity and clarity. The next sentence, so we can change some of these sentences to be more specific. So if the topic is African Americans, we can clarify that these are a particular population at risk. The motivation again remains late presentation, but we now refer specifically to the problem within this population. Now we follow with some detail about the angle by which we try to address this problem, i.e. a training program targeted at African American opinion leaders. The last sentence of the background then sets the scene by specifically stating the objective of the study. Here, this was the evaluation of the educational component of the program. A good introduction will lead readers through a type of information funnel from the general topic to the specific aim, convincing the audience of the importance of the theme and study. Now that we have raised the expectations of our readers of what is to come, we give them the tools in the description section to understand the findings. The details of your description section depend on your type of study, and it's really hard to generalize. So this could be an implementation, an evaluation, a survey. So though not applicable for every study, think of the following questions. When was the study conducted? Where? Who conducted the study and who was the study population? What were the main outcomes measured, and how was the data collected or analyzed? Answering these questions in your method or in your description section will give readers information about the population, the context and time frame, the content and execution of your work, and how you arrived at your findings. This section is critical for reviewers when they judge your abstract. So you want to make sure that this description section is as accurate as possible because it's really critical for reviewers when they judge your abstract. Let us go back to our knowledge training program for opinion leaders. The method section here gives us some detail about how the description section gives us some detail of how the program was implemented and how it was evaluated. So here are the 5 questions we are looking out for. When was the study conducted? Well, there's no information actually in here. Where was the study conducted? Again, no information except where the participants came from. So that is quite important for people to know. The description section also tells us that the target populations were opinion leaders. Important information, but the research team conducted the study is maybe a less important detail, unless it was maybe not obvious that they were the ones doing the research. So you could say, if you might want to add more detail, for example, that the study was conducted in collaboration with the Light for Life community-based organization, then that is maybe an important detail you want to add. What was the main outcome measured? From the test, we know the questions assess knowledge on HIV, which could be the outcome of interest. Although this could be a bit clearer. How was the study conducted? We are told it is a test before and after the training, so it would be good to have more information about the test and how the findings were analyzed. So we agree there can be some adjustments made here. The training program, so an improved version could look something like this. Here we have added more detail about the training program. We now include information about the when and where. We also want readers to know about the study population and how the participants were selected. Again, that's information we've added here in this section. And finally, we can add more clarity on the outcome measures, how the data was collected and analyzed. So in this case, through summary statistics. Having sorted out the description section, we come to the all-important lessons learned section. Here you should describe your data and findings, not someone else's. The purpose of the lessons learned section is to show what was the knowledge you gained, and it should be written in the past tense and be as specific as possible, especially if you have some quantitative data. You should really show up those numbers. In this case, you should also be careful to avoid vague terms such as many or some. This can mean different things to different people. Also careful with qualitative words that are not substantiated. Important benefits were noted. Significant differences were seen. The readers will really want to know how you ascertained this. Remember what you promised in your background section. Your results need to, or your findings need to relate back to the aim you stated there. Differences between subpopulations can have an important effect on outcomes, and wherever applicable, you should disaggregate your data by sex and gender and provide relevant analyses. Let's find out how good our opinion leaders fared in the tests. The lesson learned section reads as follows. And here are the elements that we are looking out for. Is the data described from the study? Yes. Although in the last sentence, the authors refer to another study. Is it written in the past tense? Yes, it is. The findings described in the most specific manner, or there's some most or significant increase here without really numbers. So that's maybe something to improve. Do the findings link back to the aim? Yes, we are comparing before and after test results to evaluate the training. Are data disaggregated by sex? It states that how many male and female participants took part, but there is no gender analysis as such. This section obviously needs some improvement as well. So the first, we should first of all not start a sentence with a number. As you can see here, the first sentence read 79.31%. So you should not start a sentence with a number. So you should rephrase this. You can see we also added more information about what a complete data set means. Then we go on and take all the demographic data and place this in a table, because that will free up space for more important results in the actual text. So now we have deleted the other people's, study we referred to here in Uganda, which should not be in our lessons learned section. And we've also added a gender analysis. So the bottom example is now a much more improved lessons learned section. As mentioned, we try to put some of the data in a table to free up space. So I just want to mention a few words about tables and graphs. You need to make a judgment call of whether your data can be more clearly and concisely presented in a graph or table versus text. Rules of thumb here are do not repeat the data in tables and in the text. Use tables for big data sets and graphs to show trends, for example, over time. Just because you're allowed 3 tables and 3 graphs does not mean you should add all 6 come what may. Use them wisely as they do break up the textual flow of your abstract. Make sure your table or graph is easily readable and interpretable. I jumped ahead there. Okay. And also be careful with, so you have to label axes, columns, and rows, and always provide headers and legends where needed. Okay, let's look at an example. Again, this is a table that could use some improvements. First, it would be good to add a title, so the table can stand on its own. Then the columns need headings to help readers understand what the numbers mean. Also careful with colors, because they might not show up in black and white abstract books, and also some people are also colorblind. As with the results section, use decimal places consistently. And again, you should add units where they are needed, because otherwise people won't know what the numbers mean. An improved version of this table would therefore look something like this. We have now reached the grand finale of your abstract, the conclusions or next steps section. Summarizing your main conclusion involves 3 elements. First of all, your take-home message that is based on your findings. Then we step up one and mention the implications this could have. Some speculation here is possible. If important recommendations can be drawn from your data, mention them here. You can also suggest future studies and, if applicable, your limitations. Sometimes these go hand in hand when you know the limitation of your study that should be addressed in a future study. Therefore, think of these 3 questions when writing your conclusion section. What is the important information from my abstract? What do my findings mean to the field? What are the next steps to be taken? As I mentioned, this needs to be strictly based on your findings. Space is precious, so avoid obvious statements and repeating your findings again. And also do not overgeneralize. Let's have a look at our example. Here, the main message is from the authors is that the knowledge is increased. According to them, the implications are that these are important findings and have worldwide significance. They recommend that more such training programs should be developed. I think we're skeptical. Repeating the results we already described is based in precious words. And why is this an important achievement? And if this is targeted at African American opinion leaders, can we really generalize to worldwide implementation? This is clearly overgeneralizing. Also, we evaluated the training and not its impact, so we cannot really recommend further programs without this additional knowledge. So this is a much more improved conclusion section. Conclusion here is based on the evaluation that the knowledge has increased of African American opinion leaders. We can therefore imply that educating opinion leaders is a doable task, and now we extrapolate a little that this could therefore enhance HIV awareness within their communities. But as we don't know this for sure, we recommend further studies on the actual impact of this program on the communities. And that is your abstract done. Just a short note about plagiarism, which Philippa mentioned is a serious offense when submitting an abstract. Plagiarism means using other people's ideas, words, or data without correct attribution. In an abstract, this is slightly different, as you will not use references unless you're referring to a very specific study that the readers need to know about to follow your abstract. However, that does not mean you can simply copy-paste other people's work, or even your own, because that might sometimes infringe on copyrights. So for the whole abstract, don't copy word for word, and you can paraphrase previously published material, especially in your background section. So that means you express it in your own words. You cannot imply that findings that aren't your own are your own, even if you don't add references. And in the results section, you cannot present, or the lessons learned section in the option 2, you cannot present other people's data or findings, and especially findings that have previously been published. So just to give you an example of a sentence that we might want to use in the abstract, prevention with a positive approach has been advocated as one of the main strategies to reduce new instances of HIV infection. So if someone would write this sentence in the abstract saying, prevention with a positive approach has been highlighted as one of the main strategies to decrease new instances of HIV infection, we can see that 2 words have been changed, but this is not really sufficient to avoid plagiarism. Expressing it on your own words, you must change it much more substantially, and here is an example of how you could do that with this sentence. One of the key strategies to decrease HIV incidence rates that has been highlighted is prevention with a positive approach. Here you can see we actually changed the sentence structure and replaced several words with alternatives, and that is much more acceptable now. Thank you very much for listening. That is the end of my presentation.
So if you have any questions about abstract submissions, you can write to abstracts@AIDS2013.org. And if you need some help, meaning the Abstract Mentor Program, you can always refer to our AIDS 2014 website. So now we are open for questions, if you have any. You can either raise your hand just up above the chat, and under the participant list you have a button that is called raise hand, or you can use the chat as you prefer. And maybe I need to mention that the video of this presentation and also the PowerPoint will be available online in a couple of days. So I don't see anyone asking questions. So we might close the webinar. Oh, yeah, okay. Now I see it. So we start with patients. Patients, please go ahead.
Hello, can you hear me?
Yes, we can.
Okay, I wanted to just raise an idea that, like the feedback that these materials are going to be available, or where, okay, that's the website. I think my computer was slow, so I wanted to know how it's going to be available on the website with the link that we can access all the material, because some of them, because of the internet connectivity, I think I was missing some of the things. So going through, I think it's going to help again.
So
that's the website.
Patients, are you talking about the material on the webinar?
Yeah, of the webinar, yeah. The presentations that we've been doing here, yeah.
So the presentation will be available on the AIDS 2014 website and the webinar link. Maybe I will send you also an email when they will be available. For abstract, in Abstract Mentor Program, you have to refer in particular to the policies and to the submission guidelines, which also are available online on the website.
Okay. Okay, thank you.
You're welcome. And now, I'm sorry, but I don't know what's your name, but I just unmuted you. The person that starts with H.
Hi, I think Nelia, you mean?
Yeah. Hi.
Hi, I have a question. Can we use the abbreviation IDUs or MSM, or we should write well the full name, the injecting drug users or men who have sex with men. I mean, in the title and in the description of the study. That's all.
Yeah, maybe Miriam, you can address.
Yeah, sure. So again, abbreviations should not be used in the title, no matter if they are very common, such as MSM or PMTCT. However, exceptions again are HIV and AIDS. In the main abstract body text, you can use abbreviations if you use that same term at least 3 times or more in the whole abstract. And in any case, you should always write it out the first time and then have the abbreviations in bracket behind full term the first time you use it, and then you can use the abbreviation afterwards. And again, stick to more to terms that are very well known, such as MSM, PMTCT. That's perfectly acceptable.
Thank you.
Okay, so any other question? It seems like we don't have any other questions. So I will end the meeting now. The next webinar will be on getting involved in the Global Village on Tuesday, the 26th of November at 7 a.m. GMT. So please register if you didn't yet, and if you're interested, obviously, in the topic. If you have any other question regarding the abstract, feel free to contact abstract@AIDS2014 or even the webinar. And thank you very much again for listening.